Thank you, Priti. Good morning, good evening, and good afternoon to all, depending on the time zone. Thank you, AeHIN. Thank you all for providing this opportunity to all, opportunity to us. Today we are going to make a presentation on digital health and standards and interoperability lab in Nepal. So we have divided the presentation in two parts. The first part will be on overall digital health policies, guidelines, and digital health progresses in Nepal. And second part will be typically on standards and interoperability lab that you have set up. Okay, let me start the presentation. This is the journey of digital health in Nepal. It was started very long before it, in 1958, and this it's been shared on various forums previously also, so I don't have to go thoroughly on it. Just I would like to say that the last achievement that we have uh, made is institutionalization of SEAL Nepal in 2024. Okay, now I would like to highlight some of the digital health policies and strategies, guidelines that you have in Nepal. We have e-health strategy 2017. It's a big picture for digital health. And similarly, in activity-wise plan, we have e-health roadmap 2019, and its progress review has been made in 2023. Then we have for health IT systems, we have integrated health information management system roadmap 2023-30. So it has specifically stated about interoperability and lab. I will come that on later. Then we have Digital Nepal framework. This is the overall framework for the development of ICT's applications in all the ministries, and health is one of the major sector of Digital Nepal framework 2019. And we have Nepal Health Sector Strategic Plan 2023-30. It has also um, stated about the digital health activities. It's for overall health sector plan, but it's also speaks about the digital health. And then we have for standard architecture, we have government enterprise architecture version 2 and Nepal government interoperability framework. This is the architecture and interoperability framework for all the government IT systems, and so that is also applicable to health IT systems, and it's similar to health architecture. And we have national development plan 16th. It's currently its 16th plan, and in 16th plan also digital health has been prioritized in health sector. And the one of the major activity that we have going on is national digital health blueprint. On the support of WHO, we are preparing the digital health blueprint. It's on the process, and soon we will complete it and will go on its implementation. And similarly, we have EMR telemedicine national policy and provincial digital health unit and guidelines. These are the policy and guidelines standards that we have for digital health. And we have many systems. These are some of the snapshots. So I have included here. We have many systems. The major systems are DSIS2, Open Insurance Management Information System, URs, early warning and reporting system, electronic logistic management information system, and similarly many systems are there. But the challenges is the systems are most of the systems are running independently with each other. They are not completely interoperable, and so we are working on that. The systems we are not being able to access data from one system to another through the seamless interface. They are not interoperable. So interoperability lab, that's why we need interoperability. And talking about interoperability, the major guiding document for interoperability to us is HIMS roadmap that I mentioned earlier. It aims to scale up and sustain standardized and interoperable health systems, health systems, building on the existing ISIMS, and addresses the need for a better integration with other health systems to optimize national health governance. It has envisioned integrated, interoperable, and technology-enabled health IT systems at all levels, and it has clearly stated about the interoperability in SEAL lab, uh, setting the timelines. So it was the timeline was to establish the interoperability lab in by the end of 2023, and we became success in set up the lab in the beginning of 2024 as per the ISMS roadmap. Uh, then, what are the current updates on digital health in SEAL in Nepal? The Obviously the major progress is on institutionalization of SEAL Nepal that we made in February 2024, and there is steering committee and technical working group for digital health and SEAL as well, and the regular meetings are conducted, and we took the necessary decisions and approval from the meetings from the committees. And we have made amendment of health initiatives in digital Nepal framework. It's a big framework for overall IT development of the Nepal government. So we have included open SIE components like health facility registry, health workforce registry, and the latest technologies like artificial intelligence in digital Nepal frameworks health sector. And we have completed the drafting of SOP and sustainability plan of SEAL, and SOP of telemedicine and EMR specifications. Uh, Similarly, we have developed and approved standard operating procedure for health facility registry and health workforce registry. These are the components of Open SIE framework. Uh, Regarding talking about the interoperability, we have implemented insurance management health insurance management information system. It's an open IMIS system. It's been adapted into the in more than 180 plus EMR, and it's fire compatible. It's fire compatible, and all the hospitals EMR started submitting claims through this system. And next one is birth and death registration and notification from health facilities to civil registration and vital statistics system is also has been made. So, what are the current updates on infrastructure in digital health? So, SEAL servers, standard interoperability lab servers have been set up in the SEAL lab within the ministry, and some of the digital health systems have been set up in Department of Health Services. It's under the ministry. Health services servers, and some are running from G Cloud servers, which are set up in Government Integrated Data Center. It's a national data center of the Government of Nepal. And but different hospitals are implementing EHR EMR systems independently with the systems hosted on their local servers, because in many hospitals they have their own servers, and they are implementing the system set hosting on the local servers. So there are some of the issues like data backup, security, and etc. And what are the issues and challenges in digital health in Nepal? So we are lacking management of health IT system is lacking both a clear vertical organizational structure as well as competent and committed health IT personnel. And of course, there is always challenges of health IT competent personnels. And similarly, the systems, there are many systems they are running, but they are running independently and are not interoperable with each other. We are not being able to make them fully interoperable. Just Open image system is interoperable till now, and other systems are running independently. So that's why standards interoperability lab is working on that. And servers also are not well managed because they are locally hosted on the hospital servers, and there are no backup policies and business continuity plans because there is no proper data center, proper disaster recovery center, disaster recovery servers, and etc. And security issues are also not properly addressed because in remote places hospitals are not that level of resources, and hospitals are using various ESR systems developed by different vendors, and the systems are so we are not being able to automate all the health cycles, patient treatment cycles like uh, prescription, pathology, and etc. They are mostly focused on billing only. And the obviously the one of the challenges, we have established the SEAL lab, but the sustainability of SEAL lab is also it's a challenge. So we have developed a sustainability plan to implement and to make the SEAL sustainable. So our what are the future plans in digital health and seal lab is the main plan we are making is develop and implement digital health blueprint that I already mentioned with the support of WHO and other EDPs. So we are developing the digital health blueprint, and we have expected that it will address the required standards, SOPs, health policies, and architecture for all the three tiers of government. And as a costed, action oriented, and time bound activities. And next one is with that blueprint implementation, access real time integrated data from all the health institutions, collected and integrated data, and utilize the data for national planning in achieving universal health coverage. So this is the ultimate goal of digital health and Sil Nepal. And one of the major requirement in the government of Nepal's ministry is to establish separate organizational unit for digital health under the ministry. There is quality standards and regulation division, but it's not fully dedicated to for digital health. So we have feel the necessity of the separate unit, separate digital health unit. And of course the main part of the digital health implementation, successful implementation of digital health is the competent human resources. For that, we are planning to develop competent and dedicated health IT personnel via industry academia collaboration. For that, we have already made a couple of discussions with the universities, Kathmandu University, Tribhuvan University, and other academic institutions to develop the competent, the cross disciplinary human resources. So now the next presentation is on typically the standards interoperability lab in Nepal. Just I would like to say its organizational structure. It's under the ministry's QSR division. This is Quality Standards and Regulation division. And then under the division, that is IT section, and under the IT section there is SIL lab. And then we have experts from health information system, public health, and similarly IT. And we have subcommittees also. We are planning to develop subcommittees. And currently, the working technical working group is the executive committee of the SEAL lab. It's chaired by the QSRD division head, and the director of curative service division is the member. This similarly, chief of ISMS section, Department of Health Services, is a member. Representative from Ministry of Communication and IT is a member, and chief of digital health section. It's IT section. Currently, IT section is a digital health section, is a member secretary. Additionally, we are planning to form different committees like developers committee, standards committee, testing and certification committee, quality assurance committee, and a user committee, etc. To run the lab, to make the lab fully functional. So for rest of the presentation, I would like to invite Mr. Sanjay Poudel. He is the team leader of the SEAL Nepal. He's leading the expert team. And so, okay, Mr. Sanjay, over to you, please.
Thank you, Ramesh, for the brief overview regarding the policies and in-place document that MOSP and also the Nepal government has planned, also the achieved milestones till date. So can you go back to the previous slide, please? Yeah, this one. So starting from the 2015 ICT policy to 2023, where the lab started, we have crossed few of the initiatives which has directly impacted to the policy and also with the governance, starting from the 2017 e-health strategy to IHMIS, wherein OpenHI framework and also the TOR initiatives for the SEAL has been endorsed by the IHMS roadmap. Can you go to the back slide, please? Yeah. No, back slide. Okay. Yes. So IHMS roadmap within the SEAL is one of the deliverable for the roadmap that was endorsed by the IHMS department with the 2022 to 2030 vision. So technically, the seal was carried out in the inception in 2021, and the physical lab was started in 2023. Next slide, please. So the core mantra of SEAL Nepal is the approach called GCTC, wherein governance, community, technology, and content remains in place. So next slide. So for the governance, there are multiple component that has to be within the ecosystem, because it's not only about the technology, but also the multi-stakeholders engagement has to be there, wherein steering committee is there under the leadership of MOSP secretary, and also with the guidance from the QSRD division. Uh, Not only limiting to government presence, but also inviting every aspect from community to academic sector, and also with the regional collaboration like AeHIN and COIL country members, uh, wherein we have also invited the local users community. If we see the local community like CST is there, Community Health Toolkit is there, and also the OpenMRS user group is there, academic sector like Kathmandu University is there, and not following the users, but also with the developers community, and uh, all the developers and the quality assurance team is there. Uh, and interministerial and also the interdepartmental coordination is must, because Ministry of Health itself can't comply all the requirements of the health information architecture. MOS has to be there, DOIT has to be there, and all of the EDPs who are working closely with MESP, supporting the different initiatives, is there as the external buyer or stakeholder for support the MOSP. So beyond the governance, we recently have started this government marketplace, wherein we invite the different government stakeholders so that they can showcase the proper use case that has been carried out through the webinar and also with the physical meeting. So let's take the example. We have the next government marketplace happening in a few weeks, wherein we have invited the health insurance board to showcase the use case, how successful the insurance program and OpenEMIS is supporting the universal health coverage. So likewise, we'll also be inviting different interministerial engagement who is directly or indirectly supporting the MOSP initiatives. Next slide, please. So community reference to the, as Ramesh mentioned, we have partnered with few of the academic institutions. Till 10 of the academic institution has already been onboarded with SIL Nepal initiatives, where we directly engage with academic sector and also collaborate to identify the future digital health leaders. So we basically onboard the academic institution to get into the ecosystem of digital health, and also enable them to be the part of SIL. Along with the DHAP program, we have the community of practitioners, where we invite the different initiators and also take the advice, uh, uh, take them to the ecosystem of the standards and interoperability. Hear the suggestions, hear their expertise, and enable to engage with continual community meetings, and also support to enhance their current initiatives. So let me go to the technology and framework part, wherein this maps out the current architecture that MOSP has uh, endorsed as the guiding framework to implement for the health information exchange. So this framework basically has been endorsed by the IHMS roadmap as well. Here in the diagram, we have tried where our current initiatives is being mapped with the core architecture. Let's say for the logistics part, we have the national level ELMS platform that is being used by the logistic management division. And then for the aggregated routing health information, IHMS, wherein DHIS2 is implemented. For the finance and the universal health coverage, as a stakeholder, Health Insurance Board and Social Security Fund have fully utilized the power of OpenEMIS. Shared health record is under the review stage. We haven't finalized yet. So that's the role of SEAL, and also with the MOSP TOR that has to be implemented going forward. So in terms of the terminology standardization and terminology services, HMIS has the largest stake on the terminology services, where the element standards and the variable standards has to be there, and we have already started to work with IHMS to work within the National Health Data Dictionary, for which we are closely working with OCL community. On top of that, for the disease classification, ICD-11 is already in use case. For the client registry, national ID and as the identifier ID, and on top of that, functional ID is the secondary discussion that has been initiated. The idea is to align with the framework. That's why we believe health ID will be the functional ID to connect with the identification of the patient when there's necessity to share the health information among the different providers. So facility registry and health worker registry has already been endorsed and is under the review stage. Once the interoperability and the elementary level inspection gets completed, we will be implementing these two registries within the national registry. So product catalog, for the product catalog part, technical specification bank, and we are working with the DAMS, the current drug information system, and also with the other specification that has already been in place and is being used by the Ministry of Health, and also within the Department of Health Services. So as for the interoperability layer, a simple use case has been recently completed, wherein the community health data gets synced back to the facility-based care using the IOL layer called the AeHIN. We are still in the evaluation stage, not used in the national use case, but once everything gets in place with the use case that we have tried from SEAL, we will onboard this layer to the other business service layer along with the registries. So that's for now. The current stage is under the evaluation stage. And for the point of services, definitely there are multiple services being used. To name few, OpenMRS as the open source global good is the use case. And for the community health programs, community health toolkit being supported by Medic Mobile is the use case. And other systems are there. We have already onboarded them. They are aware of the fire and also the standardization that needs to be taken care of when we think to share the information within the national information system. Next. So in terms of the content, we are very aware these are the foundation work that needs to be done before we proceed to fully materialize the health information exchange architecture. So few of the groundworks that are currently in place are terminology and National Health Data Dictionary. As I mentioned, AMR is the first use case that we have already started working with multiple EMR companies, because that's the first use case that was asked by the National Public Health Laboratory, being supported by a few of the EDPs. Metadata standards, that's where MNCS program is started, and closely working with the IHMS, National IG Fire, that's already in place as the use case, because most all of the healthcare institutions, they have already started to send the claim record from EMR to OpenEMIS using the National IG Fire as the first use case. For the SOP regarding the EMR and EHR standardization, as Ramesh mentioned earlier, this is under the review stage. Once the Ministry of Health and the Steering Committee endorses this specification, we will be sharing this to the LG along with the different EMR companies. So common data model is the ask from the community itself. So we aim to follow the OMOP or OSDSI framework. For that, we are working with the OSDSI community for the same, and is heavily engaged with the researchers. Next. Current progress, EMR SOP, sustainability SOP, and lab SOP. DHB partnership with academic institution monthly webinar is in place. Leadership onboarding program in support from the Kathmandu University. and Tulkel Hospital. That's under the curriculum stage. Web content development in regards to the seal and all of the policy related document and also the initiatives will be published and is being published at the seal dedicated seal website under the MOHP section. National Health Data Dictionary, as I mentioned, MR and MNH, maternal and child health is the use case. Standard checklist, wherein all of the EMR companies and also all of the digital health initiatives will be using the checklist, self-checklist mechanism for now, but ultimately the sandboxing approach will be there in place. Lab KPIs, fieldwork plan development for the next step, and the few of the analysis are in the next phase engagement, and we are eagerly waiting for that. So can you go to the next slide, please? So not only limiting our team or limiting our initiatives to Nepal, but also we have this global collaboration where we ensure that all of the initiatives that whatever we have decided as the framework, as the guidelines, we make sure we are aligned with the global initiatives. That's why our stakeholders alliance is much strong and we are fully committed with AeHIN, OpenHI framework, OpenHI community, OpenMRS community, and so on and so forth. So these are the few of the use cases, few of the representation from Nepal that recently happened in Taiwan as the Connectathon. Mr. Subhas was the part who represented Nepal, and also the recent OpenHI community meeting at Sri Lanka was truly benchmarking stage for us, wherein we got chance to speak for on behalf of Nepal initiatives, and also we ensured we validated our approach with the larger community because, as I said, we are in the very early stage. That's why we can do a lot of things, learning from the other countries' initiatives, and not to repeat the same mistake or not to repeat the same initiatives, but truly need to align with the community. Next slide, please. Other stakeholders alliance with AeHIN and also with the OpenHI community, representing MOHP and also the Nepal-based implementers community. I'm happy to answer the question if there are any. So that much from my side, and thank you AeHIN and Elvin for always encouraging us to be very participatory and supporting us to lead the Nepal-based digital health initiatives. Thank you. Thank you, everyone.
Okay, thank you, Mr. Ramesh and Mr. Sanjaya. We will now proceed to the Q&A questions and answer here. Okay, so for the first one we have in a Q&A box from Dr. Madan. What is the sustainability plan of SIL?
In last picture, definitely I think Ramesh has also mentioned the appetite to establish the separate digital health unit within the Ministry of Health, which ideally is the requirement for the sustainability. And also in terms of the financing mechanism, there has to be the mechanism since recently the steering committee and also the working group has been recently formed. It's just 9 months. The aspiration for us right now is to onboard the government to make them understand about the importance and also importance of SEAL and also the onboard within the tier of Nepal government in the national program or national deliverable. So I see things happening, but definitely there are sustainability questions and sustainability discussion ongoing within the Ministry of Health. And I believe at some point, maybe it may take time, but the realization is there, and let's be hopeful for that. But for now, I don't have the precise, but the sustainability at such to the answer is to onboard MOSP and treat these initiatives either with the QSRD current initiatives or separate unit has to be there so that funding and process integration will be in place. I hope I answered your question.
Thank you, Mr. Sanjaya. Also, the second question from Dr. Madan also. When will the blueprint for digital health endorsed?
So far, what I have got within the TWG and within the seal is the zero draft has been drafted and has been shared with MOSP. I believe that's under the review stage unofficially. That has come up, but when we are waiting for the TWG meeting to happen, and then we can evaluate from our end. Our means since I'm representing still, we are in the stage to evaluate, eagerly waiting for that. So zero draft has already been formulated.
Thank you. And also, we have some questions from Dr. Alvin in the chat box. Okay, for the first one is, for the future state, have the responsible agencies been identified for each open HIE component?
Yes, Alvin. So as I mentioned, IHMS roadmap is the key guiding document for all these SEAL initiatives and also the for the identification of the core standard framework. So OpenHI is in place. That's the reference framework, definitely. So that's if you remember my previous slide, we have mapped out every deliverables which can closely align with the OpenHI framework. So our guiding document, guiding framework is OpenHI itself.
Uh, s- um, Excuse me, please. Sorry for being disconnected. Uh, I think in Dr. Abling's questions, may I add something, please? Oh, hello.
Yes, sir. Yes, sir.
Okay. Uh, I think the question was, so who is the responsible so entity, or you, is there any responsible unit or not for OpenAI components? And of course, we have responsible units and sections, but not specific separate departments. But for now, the SFR and NSFR is overseen by the PPMD division, and similarly the for other components there will be a separate dedicated section or division to implement OpenAI framework. I think it was also the question from Dr. Alvin. Thank you.
So Alvin, going back to your other question, do you have plans for conducting a conference? So definitely yes. We got chance to speak with you even during the OpenHI community meeting, and after that, we have shared our appetite to the concerned department within Ministry of Health, and are under discussion. And Ramesh is leading the conversation to make this happen. But as a community practitioner, uh, I'm happy to be uh, hosting the community here in Nepal, as also as the not only with the Connectathon but also the AGM of AeHIN as well. So we really look forward for the decision from MOSP itself. The other question is about the ELMS. Definitely, Alvin, our logistic management division is also using the ELMS as a national level implementation. We can have the separate discussion on the architectural part, but yes, we use the same approach, or we use the same platform. How did the point of service system receive the news of this sale? Was it easy to get them to participate, or were there challenges? So very good question. We recently onboarded the local governance, the federal governance as well. One of the province is directly and closely working with us. They are taking the advice. They want to build this federated architecture within the provinces. Also working with the separate digital health document, policy document, and are eager to align with central level architecture and also with this SOP. So that's the first use case, but definitely the appetite is there. Other provinces are also eagerly waiting for the national level SOPs like EMR, SOP telemedicine guidelines, and all of the IGs that we are planning to build from the SEAL, and also the NSDT that is being endorsed from SEAL, and also with the AMR initiatives. Ramesh, is there anything to add on which I might have left?
Actually, I lost the chat questions, so I could not understand. I think actually, so I think it's
Okay, so yes, and I'm glad to
because
know.
I missed the questions because I got disconnected, and so I missed the chat questions. Sorry.
That's okay. I can cover. So last question that last suggestion from Alvin is that UPMC Lab, we offer our services for free. The private sector pay us. I think that's perfectly fine. We are in the very early stage, but definitely the matured community has to be there, and financial implication is already there. We are happy to coordinate. We are also supporting. We are also following the UPM SEAL Lab initiatives, monthly webinars, and the content that the reach of contents that is being delivered within the larger community. And we truly admire the initiatives that UPM is taking over. And also, thank you for the points and the suggestion regarding the OpenHI adoption. As I said, we are in the very early stage, but we are not repeating the mistakes that other initiatives, because that is the asset of community, and that is the asset that we get from the continual engagement within the community. And thank you for everything, Alvin.
And I would also like to take this opportunity to thank Dr. Alvin for supporting us to establish the lab, because you have provided us the guiding document and supported us on different aspects. So thank you very much for, and we
And
expect your.
yes, last.
You're welcome, Ramesh G and Sanjaya. Maybe if there's something you need for 2025, what might that be? Like if you have like what a top three things that you hope uh will happen, or something that you would like to have by 2025, what might that be? So we can, like consolidate. We can also ask the other labs in the other countries, and then we can consolidate our request. Please go ahead. Maybe Ramesh
Uh,
G first. What will be
okay,
your top three
okay,
wish list?
okay. By 2025, I hope we will have required standards and architecture to make the systems interoperate with each other in the context of Nepal. Of course, we will follow the international standards, but we will customize them in the context of Nepal, and we'll have set the standards, and we'll have still sustainability plan to be implemented. And then I just want to say, I would like to say that we'll be in the position of providing the service to the systems and our related stakeholders, what they expect from the SEAL lab, because we are just starting the lab. We have to do more. So by the end of, by the mid of 2025, and then we'll be fully functional, and I hope the lab will be fully functional, and we will have the standards and the architecture, and we'll make most of the systems interoperable with each other, and we'll be able to access the data from one system to another through seamless interface. Thank you. So, Sanjay, would you like to add something?
Uh, Thank you, Alvin, for this opportunity to ask from AeHIN, actually. So, what I feel from SEAL perspective is we need two C at the moment: content and community engagement. So, in terms of the content, we really want to collaborate. uh, our first priority for now is the dictionary. Okay, so for that, DHI has to be there. I really want to hear the experiences of other countries, and also take support the pain and relief part, following the documents, approach, principle, process for the dictionary part in terms of the content. And also for the community, since AIN is there, we want to make sure the ask or the appetite or aspiration within Nepal to be spread with other communities around the world, maybe IHE, or maybe other initiatives that's being happened besides AIM. So these are the two asks for now, but I think the other aspect that we really want to collaborate and also ask the other community is the governance. How the governance or government has to be engaged within this ecosystem. So that's the strongest foundation that has to be in place. So these are the three major asks for now. For further, we can definitely chat. We really want to hear your experiences since long that we have been engaged with multiple countries' initiatives. So precisely 2C and 1Z.
Thank you, Sanjay, Ramesh G. Those are very good requests. We got them on record, so we'll find a way to address them so that you can get at least, if not all of the wish list, some parts of it. So one of the things that are emerging from our own experience in the Philippines is the creation of a third subgroup inside SILAB. So there's the clinical subgroup, there is the um, technical subgroup, and then there's a third very, very small but very important infrastructure subgroup. So I don't know if that's also maps to your own committees or subcommittees. A clinical group made up of clinicians and health workers, an infrastructure group, very technical people, also security aware, and then the technical group would be the ones writing up the implementation guides and the four profiles. Do you also have the same groups over there, or maybe you have extra groups over?
Yeah,
Go ahead, Ramesh G.
um, sorry, my internet is connection is unstable. Okay, thank you. When you have focused on this to create three groups, one is infrastructure, one is health, and one is clinic, and one is public health. That's a very good and success practice and success key idea. So we'll of course we'll try to make that type of groups in lab, and that would be um, uh,
Uh, to add on, I think we missed internet. To add on, so there are appetite and there are requests from the clinical user group, from the IT infrastructure, cybersecurity. Like Dr. Modan is here. We got this chance, this opportunity to work under the leadership of Dr. Modan. So he initiated so many things. So now there are certain deliverables that has been precisely defined. So we really want to continue this engagement from the government side, also with the leadership, and to work with the different working groups. Definitely that has to be, like I said, NSDD is the first use case. So we have already onboarded the few of the stakeholders. Being said, HMS is the working group for us for now. Structurally, definitely, we will come up with the ideas. It's a very early stage. AMR working group is there. So for the surveillance, 26 different sites will be sharing the AMR based data. So for the cybersecurity and for the uh, uh, security part, the group has to be there. So once everything is gets in place, we'll come up with the ideas. But for now, we are truly following the OpenHI community. They have this difference. So for the terminology standards, there are some people who is closely working with following the initiatives, so that gets aligned for us as well as the supporting. And for the cybersecurity, for all of the working group within the OpenHE we are following, but for the localization of the group, we will come up with the different working committees, subcommittees very soon. We'll update on that, Alvin, and a very inspiring suggestion to get in tact with the different initiatives. Thanks.
Thank you, Sanjay. Let's compare notes. I think every month we will have another lab presenting what they are doing, and then after they make a presentation, then we can also compare notes as to what might be good practice and what might be areas where we can improve. The infrastructure is, I think, one of our lessons in Silab is the infrastructure can be very, very complex, and um, we need to have the right people, and there's also a lot of risk involved when you start building up the infrastructure for production. I think infrastructure for testing is okay. We can relax. There's no real world data. We tell people you can use it anytime. You can even try to break it because it's just a test environment and there is no real world data there. But when you start converting the infrastructure to production, that really will extract a lot of accountability on the lab people. So in the Philippines, we decided we will not do real world data. No, I'm not sure if you also have the same sentiment. But if we if we decide to do production, we are going to suggest to government to outsource it to another group, not to the lab. But that's our country experience. I think the real world data is really very sensitive, and if the lab takes care of the testing and also takes care of the production, I think we will have a difficult time juggling both. So we decided to just focus on the testing, and then we are recommending to the government to get another provider for the production level. But the lab will be informative to the outsourced company because the lab will become the reference document, so to speak, for whoever will be the outsourced company managing the production mode fire server. Okay, I think Sanjay, so maybe just comment on that. If is the lab in Nepal thinking of production or just testing for now? Over.
For now, it's the testing and enable the initiatives to follow the standard approach. So for now, teaming and testing, and also training, of course.
Very good. I agree. I think when we start putting our heads inside the testing, then that's the time we will really see the complexity of production. Because testing in itself is already complex, and when we see, when we understand what this test environment is all about, then we will realize, wow, we really need to get another group of people to manage the production. I hope that we can share our testing experiences so that we can also like make recommendations on maybe there are some components that we need to remove because they just add more complexity rather than simplicity. And then maybe we need to add something that is not yet there in OpenHIE. Although I do not find anything missing there. No, I think the real complexity is the point of service systems. They are all over the place now and they are not really following the standards yet. And that's why the pressure on the lab is to set up the test environment very quickly so that they can already tap into the test environment of the lab. So thank you very much, Ramesh G, Sanjay. I see Dr. Madan. Thank you, Dr. Madan. I see Dr. Sunita, Santosh, Subas. Thank you very much for being here. I think this is the time, PT. We can have our picture. Can you take care of that, PT?
Yep. Thank you, everyone, and Dr. Alvin also for contributing in this. So we are going to have a picture together. So if any one of you would like to join, please turn on your camera, please.
And while we're waiting for the people to turn on their camera, I'd just like to say that I'm very impressed with the SIL Nepal because from 2, 3 years ago, when we were just thinking about a dream to have SIL Nepal, I was impressed that you had the largest contingent in OpenHIE. I think that's really a significant achievement. It's like you're expressing really your serious intent to set up the lab in Nepal. And then I think we also have Africans in the call. We have Gilbert Muthi. They're also setting up their own interoperability lab there. So thank you very much, Gilbert and Dr. William, for joining us from South America and Africa. Are we good, PT? All right. Thank you, everyone. Good night. Good night. See you in the next laboratory presentation. Bye-bye. Thank you,
You,
PT.
you, Dr. Alvin.